Staggering numbers. Nicole, thank you. Turning now to the race to protect students from COVID-19 before they head back to school in the fall. The Food and Drug Administration says the Pfizer vaccine is safe for kids as young as 12, and shots could begin as soon as a federal vaccine advisory committee issues a vote on recommendations. That vote is expected to come down Wednesday once the CDC officially signs off. The FDA did test more than 2,000 volunteers ages 12 to 15, a study that did not find any COVID cases amongst fully vaccinated kids. Here are the numbers as of tonight. More than 115 million Americans, about 34% of the population, is now fully vaccinated. And I'm joined now by Dr. Ajay Bhatt, Senior Vice President and Chief Medical Officer at the American Hospital Association. Thanks so much for being with us. We appreciate it.
Thanks for having me.
I know this phrase.
Go ahead.
Okay.
Great to be here.
Good to see you. I know this phrase can sometimes be overused, but the fact that we're going to add potentially after Wednesday, add 12 to 15-year-olds into the vaccine eligibility mix, that does seem like a game changer for a lot of families looking ahead to the next school year.
Yeah, I think it's incredible news. And, what this means is that kids through middle and high school will have the opportunity to be vaccinated before the fall, alleviating many of the hurdles schools face in stopping transmission. And certainly, while children are not considered high risk for severe illness from coronavirus, there have been nearly 4 million infections. Some have certainly died. The kids represent about a quarter of the U.S. population, particularly with this 12 to 15-year-old, and vaccinating them is critical to stopping the spread of the virus. So it's really, I think, important to getting us back on track and beating this virus.
Because if this does become official this week, it does add about 17 million more Americans who now are vaccine eligible, which makes about 85% of the total population of America eligible. Do you think then this is also a giant step toward that elusive carrot of herd immunity?
I think it's a great step forward. The more and more people we can vaccinate in this country, 75, 80%, the better we are going to be to keeping virus transmission low in the community. And that's a key factor in helping us beat this pandemic. And to the point that we're seeing, around variants, minimizing the risk of variants emerging from this virus.
And as we speak tonight, roughly 153 million Americans have had at least one dose of the shot. So that's 57% of the eligible population, 46% of the total population. I know that's a lot of numbers, but does it seem that we are on the right pace here? We know right now that supply is a little greater than demand, but based on those numbers, does it seem that we are still headed strongly in the right direction?
Yes, we're headed in the right direction, but the issue that concerns me is it looks like we're plateauing. The last 7 days, the average in vaccinations has dropped, which means that we're just going to have to work harder to go the last mile, to meet people where they're at. We're seeing the transition from mass vaccination sites to pop-ups and airports and baseball games and subways in New York City today, for example. And so I think we're going to have to do more of that to reach those that are vaccine curious and vaccine hesitant, but also important not to be confused with the issue of access and education, which are also critically important. And I think that having the kids be vaccinated will help us, but it's not going to get us all the way there because we still know there are folks that don't want to be vaccinated.
And speaking of that very issue, that's so interesting because this does feel like such good news, but we also know that the country is very divided on this issue. The same way masks became a divisive issue, so are these vaccines now. So even though the eligibility pool is opening up, if you're the child of a parent who doesn't want the shot for whatever reason, then that same hesitancy or reluctance or outright refusal is something I would imagine the non-vax parents of America will pass down to their kids as well, most likely. So it is a push and pull effect, as most things.
Yes, and I think I would say that the important thing to recognize is these are the three vaccines we have in play. Pfizer, Moderna, and J&J are safe and effective. And we're seeing, again, as you pointed out, more than 2,000 children with no cases of infection. That's 100% efficacy. And I think I feel very comfortable in this. And as a primary care physician on the south side of Chicago, and working with patients that are disproportionately affected by this virus, that's who it's going to be critical to get vaccinated, because those are folks that can still potentially have virus and spread it to others in the community. And if we continue to have more virus in the community, then that means we're not going to get to the place where we can keep virus levels low and beat this virus. And so I also wanted to just correct that. Although I had the great honor and privilege of serving as Chief Medical Officer of the American Hospital Association, I've since left that role and taken care of patients on the south side of Chicago.
I apologize for that error, and we'll correct it for next time. And I appreciate you giving us a few minutes tonight. Thank you so much, Doctor.
Thanks so much. Great to be with you.
Appreciate it.